Hello everyone. This topic is about blood drugs. The drugs used to treat different disorders associated with the blood and thereby treating the cardiovascular diseases. So when you think about the blood drugs, what will be the conditions like? There will be bleeding disorders, clotting disorders, genetic disorders. So you keep everything in mind. Let's see different blood drugs. Blood drugs, these are for the pharmacology. Never section is part 1, cardiovascular diseases, and there's a fifth the section I have put as blood drugs. So different categories under blood drugs are platelet inhibitors. Platelet inhibitors preventing the clotting. So the very popular drug is aspirin. So everybody know aspirin is one of the popular drug, to prevent blood clotting, especially during myocardial infarctions. But again, like all other drugs, even the most popular drugs will also have side effects if not used properly. If because there will be different toxicity of those effects. So again, one of the this aspirin inhibits prostaglandins, and if you take it unnecessarily or sometimes it can cause GI issues, etc. So keep it's like an emergency medicine. It's useful. Again, depends on the patient's conditions. Okay, aspirin is not recommended for asthma patients. So you have to think about all the key points in our first video, like indications, contraindication. Like contraindication for aspirin may be asthma. It shows that it's not useful for asthmatic patients. So otherwise, it's a very popular drug um, for prevent clotting. Anticoagulants again comes heparin, warfarin, very popular drugs. It prevents blood clotting. Thrombolytic agents, so prevents the formation of thrombus and prevent clotting. It's streptokinase. Wow, very popular. So you think that of streptos reminds of microbiology, isn't it? Like streptococcus, all those things. It's like streptokinase. It's a thrombolytic agent. Treatment of bleeding. Treatment of bleeding. It is to prevent. Sometimes if there is heavy bleeding, then that's not good as well. It can create all these anemic issues. So we have to prevent that. So these drugs are popular drugs are tranexamic acid, protamine sulfate, vitamin K, so they prevents bleeding. So this protamine sulfate and vitamin K can be used as opposite drugs will be heparin and warfarin, so they're like opposites. Okay, one prevents clotting and this one is for clotting. Okay, treatment of anemia, folic acid, iron, it's very popular. Folic acid, it's very important. Folic acid for pregnant ladies to prevent these neurological difficulties, and iron is for when it's anemic you need irons. The treatment of sickle cell anemia, it's like genetic disorders, comes under biochemistry. It's about the amino acid glutamate. It's replaced by valine, all those biochemical. So it is mainly seen in African people. So, and the main issue is that instead the blood's shape of the RBC has changed to sickle cell, so it will be like sticky and it can cause very painful body conditions. So it's very important to treat them with transfusions and medication. And one of the drugs used for sickle cell anemia is hydroxyurea. So these are all the different categories that comes under blood drugs of cardiovascular diseases. Thank you. See you in the next video. Bye.